Heart disease is the #1 cause of death in the United States in both men and women, but many people, especially seniors, may not know if they're at risk. This February is American Heart Month, and we're pleased to be joined by Dr. Stephen Angelo, New England Chief Medical Officer with United Healthcare, Medicare, and Retirement, who can provide a few tips as how you can reduce your risk for heart disease and enjoy better overall health. Thanks for joining us today, Dr. Angelo.
Thanks for having me.
Well, first off, let's start with some of the key risk factors that you should be looking out for heart disease.
Right. That's a great question. And so when I speak with my patients, I let them know there's two types of risk factors. There's fixed risk factors that you can do nothing about, like your age, your gender, and your family history. But there's other risk factors that are modifiable, such as what's your level of stress? How much sleep are you getting? What's your diet like? Are you exercising enough? So how can we work on those? And finally, there's certain diseases or conditions that are associated with a high risk of cardiovascular disease, such as diabetes, high blood pressure, and high cholesterol.
And what are some of the warning signs that people should be aware of in case of serious heart conditions?
Right. I think in terms of cardiovascular disease, I think about not just the heart in terms of any problems with blood flow due to the buildup of plaques from high cholesterol and high blood pressure, but also organs such as the brain and also the legs. So I try to make sure that my patients are well educated on symptoms of stroke, which would be things like weakness on one side of the body, numbness, tingling, sudden problems with speaking or dizziness. In terms of the heart, I think we all know the classic symptoms. Chest pain, might be moving down into the left arm. I make sure that people understand it's typically exertional. So when they go up steps or they walk far, if they get those symptoms, that's something that they should definitely bring to the attention of their physician as quickly as possible. And lastly, one of the things that we overlook a lot is in issues with peripheral arterial disease, which typically starts in the legs, and people will have pain when they're walking. So that's another symptom to bring up to your doctor.
And now I know you mentioned that there are some risks that you can't fix, but what are some proactive steps that folks can take to reduce those risks that they can fix in terms of heart disease?
Yeah, so get to your doctor, right? And make sure you're getting things like your body mass index measured, which is essentially your weight and your height. And then that gives you a number which tells you where you are in terms, are you overweight? Are you obese? Get your blood pressure checked, either do it yourself or at your doctor's office. Also, blood work is important to know what your cholesterol levels are, as well as whether or not you have any evidence of either pre-diabetes or diabetes based on your glucose testing. In terms of the modifiable things that we talked about before, reduce your stress, try to meditate, watch your diet, make small changes, try to incorporate more exercise, and finally, sleep. Right? Make sure you're getting plenty of sleep, 7 to 8 hours at least.
Awesome. Well, those are some great tips for us. Thank you so much for joining us today, Dr. Angelo. That's all the time we have.
Absolutely. Appreciate it.